Hi, I'm Dr. Joseph Ranieri, Medical Director at Seabrook. How has anything that has arisen out of this COVID-19 pandemic affected the healthcare field? And I can tell you undoubtedly that what it has done is polarized all those involved in taking care of patients. What this has done is we've reached out in the field of addiction medicine. I've reached out to other colleagues throughout the country and started to have conversations when this started back in beginning of March of how we need to attack COVID-19 and also treat addiction and save lives. There was a lot of uncertainty on our part. We were asked to follow guidelines consistent with long-term care facilities, in particularly those guidelines that were issued by the CDC really revolved around a nursing home type setting. So we had to formulate our own guidelines as they relate to treatment facilities, inpatient treatment facilities, as well as our outpatient treatment facilities in protecting our patients from COVID-19, as well as our staff and all the other departments. There's been an enormous amount of compassion, camaraderie, and teamwork where everyone has stepped up to the plate and have done things not necessarily that's part of their job description. For an example, I love to clean. Now, I kind of thank God for my wife, who is quite a bit of a phobia with regards to viruses even prior to the COVID-19 pandemic. So I followed her lead. And what I have done is made sure that my room and all throughout the Seabrook facility is sanitized on a regular basis. I've actually do the sanitation in my own office. So a patient, prior to coming in, the room gets sanitized, and after they leave, the room gets sanitized. We do social distancing when appropriate. That's another important concept. We take temperatures on all the patients. This is done before people are coming into Seabrook too. So we're on top of this, and we're making Seabrook a very safe environment, and we're treating addiction and we're saving lives. I can't say enough about all the departments. Please forgive me if I've failed to mention everyone, but I'm talking about nursing, therapists, recovery coaches, maintenance. I wanted to help maintenance mow the lawn. I don't do that in my house, but I wanted to help them. They got a kick out of it. The kitchen staff, the wellness department, our support secretaries. Least us not forget about our billing department, admissions, the call center, utilization review, our outpatient staff, payroll. We need not to forget about payroll too. How about our family services and our spiritual support network that we have here at Seabrook? How about our IT department and our executive management team that has really stepped up to the plate? Everyone has contributed immensely to the care of patients at Seabrook, both inpatient and outpatient.